All right. Now we are ready to go on to our second sharing of eye health talk today. Now joining me is this gentleman right here, right next to me. He is a medical doctor and also a consultant ophthalmologist as well as retinal specialist. And today he will be talking about complications of the eye with high myopia or high myopia. I also don't know what is high myopia. Just now Dr. Siang got educate me already. Above 500. Maybe can consider as high myopia and its consequences. And if you guys are suffering or also have this or myopic, please come and join us for this sharing because it is very crucial and important. And as a health specialist, just now they were telling me it is also their honor to be able to raise awareness, especially to the community here, to the Penangites here. Now joining me today is Dr. Alan Ang from Isaac Penang. Hello, good afternoon, Dr. Alan.
Thank you, Anna.
You're welcome.
And I'd like to thank Focus Point for organizing this and inviting us over to share some of our experience and also help with raising.
We are very honored to have you, Dr. Alan.
Well, likewise.
Okay, so here we go. You will be touching on the topic of complications of the eye with high myopia, right?
Yes.
Okay.
I'm going to try not to be too technical. Obviously, Dr. Siang had touched a bit on it just now.
Yes, just now.
Mentioning a few conditions.
Correct.
So I'll just elaborate a little bit more on that. So, as was mentioned before, high myopia just means anyone with short sight of around, let's say, 500 and above.
Yes.
And usually, these are eyes that are a lot longer as well than normal eyes.
Longer.
Yeah.
26.0 mm.
Again, it's all technical, but you wouldn't know what your axial length is unless we take a measurement. But just for medical terms and definitions, this is.
But it's good to know. It's good to know that you should measure your eye length.
Yeah, correct.
Okay.
So the optometrists and doctors like Dr. Siang, they are very
in tune with this.
Yeah,
we're very careful with this reading.
Yeah, correct. So, and there's a subgroup of people with high myopia where they seem to run into problems with degenerative changes.
Okay.
And in this group of patients, we call it pathologic myopia, meaning it's not just myopia, but they are developing problems with the eye.
Pathologic myopia.
Yeah, correct. So this happens in around 1 to 3% of the
general population.
Yeah,
okay.
So and it's one of the major cause of a poor vision.
Right.
And of course, if it happens at a working age, then it does have quite a lot of social and economic impact.
You will impact the way you work as well.
Yeah. So anyway, this is just a diagram to illustrate that the more myopic you get, which is on the far corner of the screen there, you find that the eyeball is a lot longer than
Semakin panjang the eyeball, 很长. Yeah, it looks very, very elongated. Very long.
So it gets more and more elongated. So that's where axial length measurements come in handy. And
so when you say just now 26 is from here to here, is it?
From front to back.
From front to back. Okay.
Yeah. So what seems to happen is when the eye stretches, becomes bigger and bigger, then the inside of the eye also seems to be more stretched and seems to be weaker, and that predisposes the eye to certain eye complications, like what Dr. Siang had mentioned earlier. Yeah, everything is just So it's not just the outside the eyeball that's stretched, the inside is stretched.
Inside also stretched.
Yeah, correct. And of course, it was mentioned before as well, not just complications with the eye, there's also psychological impact.
Definitely.
And also economic impact. So this is just, again, a diagram of the eye, and just written around, I have sort of highlighted some of the places whereby the effect of the high myopia appears to be particularly problematic.
Okay.
All right. So
the one in red, is it?
So I'll just start off with the lens. So like what Dr. Siang mentioned, premature cataract, meaning that, cataract happens in everyone.
Yep.
When we get old enough, but
Yes.
people with high myopia, they seem to get cataract at a younger age. So
At a younger age.
Yeah, so maybe in their 40s, they might start to get cataract already, whereas other people will be maybe 60 or so.
Yeah, and so on.
So they already start to develop cataract at a much earlier age.
Mm-hmm.
And one of the other things that we do find is that their cataract also may be a little bit unstable. So
really?
Yeah, because the lens in the eye is held quite firmly by this thing called zonules, which are like lots of strings or ligaments that hold the lens in place. And because in a very highly myopic eye, the eyeball is all stretched, even the zonules are stretched, and so the
Zonule
lens
also stretched.
Yeah, correct. And so that results in the lens being not so stable within the eye in some patients. I'm not saying all of them.
Yeah.
But that's something,
some cases.
something to watch for. And then behind the lens will be this area called the vitreous, which is this central bit. Yeah, correct. So so in that space, it's actually filled with a gel. And
gel.
Yeah. Like a gel, so it's a clear gel. And people who are very short-sighted,
yes,
they tend to get floaters, meaning that their gel is not so transparent.
Floaters is I learned got like a bayang like that one.
Correct,
that will
like
follow you when you turn around,
Yes,
turn your
correct.
eyeball
So
around,
I see
right?
things flying around like spots.
Not ghosts,
or-
ladies and gentlemen, that is floaters. You're not scared.
Correct.
You
Don't
should
need to be scared.
seek for help already. Okay.
So they are more prone to getting floaters. I mean, the floaters in themselves doesn't mean that it's anything dangerous.
Okay.
But it can be quite disturbing for them.
Definitely.
So sometimes when you're working on a computer screen or when you're driving,
Yes.
and then you got something just blocking
your vision.
blocking in the vision.
And it's always there, I understand.
Yeah, correct. So it's always there. Sometimes you have to move your eye to get the floater to move away. So these can be quite disturbing.
Yep.
But the good news is when it comes to problems with the lens and the vitreous, these are things that we can usually quite easily deal with.
Treatable if you have floaters, is it?
Correct.
Okay.
Usually involves surgery, but we can deal with the problems.
Okay.
So that's to do with the lens and the vitreous gel.
Okay.
Now, then on this side, when we come to retina, the macula, and the optic nerve, which is more the back half of the eye, that becomes a bit more tricky in that not everything we can treat or not everything we can cure, unlike the front part.
Unlike the front part.
Yeah, whereby it's easier to cure even if it's surgery that's required.
Right.
So when I talk about retina, what is retina? Retina is just a layer at the back of the eye, and that acts like a film in a camera. Okay, so if you imagine like your eye is like a camera and you take a photo.
Yes.
The retina is like the film.
Yes.
So it captures the light. Of
Correct.
course, that's very important.
Yes.
And you don't
to
want
project whatever you're seeing right now, right?
Correct.
Yes.
Correct.
So it's
you
very crucial.
Obviously, don't want anything to go wrong with that.
Definitely.
And a very important part of retina is this area called the macula.
Okay.
Which is the central part
Macula.
of...
First time I hear this word today.
Yeah,
Macula.
so you heard earlier on maculopathy by Dr. Siang. So that means that there's a problem, there's a damage with the macula, which is the central part of the retina. So if you imagine the retina serves the entire vision, but when I'm looking at you, I'm using my central vision, and that's where the macula comes in. So I'm using my macula to look at you. So you can imagine, if anything were to happen to my macula, your face will be all blurred. I may not be blind, but I won't be able to see your face so clearly. If I wanted to read, I won't be able to read so clearly. So that's why macula is very important.
Very important.
And when it comes to people with very high myopia, that area seems to get damaged more so
than the normal or the lower myopic people.
Yes, correct. Okay, so and there are a few things that can happen in that area. I'll illustrate with a few cases afterwards.
Sure.
And then finally, we do have the optic nerve, all right, which is this nerve that connects the eyeball to the brain.
Yep.
And that is also susceptible to this condition called glaucoma, which again Dr. Siang mentioned. That's when, for whatever reason, people with very high myopia, the eye pressure tends to go up,
Yes.
and when the eye pressure goes up,
What will
that
happen?
causes damage to the optic nerve, and that's what we call the glaucoma.
Oh,
Alright, so
okay.
fortunately, we do have a lot of treatment for glaucoma, and we can quite successfully stabilize the problem.
Yep.
But of course, we want to try and preserve the optic nerve function as well as possible, because
Yes.
whatever the eye can see, if it
Yes.
sees well, it needs the optic nerve to transmit the image to the brain. So
That's
if
right.
that's damaged, then although the eye can see,
Yes.
it can't pass the message to the brain, and so that will result in potential loss of vision and blindness
Yes.
with glaucoma.
Yep.
So here just
We
a
have
few
some comparison
examples.
here.
Yeah. So these are what we call pictures of the retina.
Okay. Pictures of retina.
Yeah. So top here is someone who is relatively normal.
Okay.
And when I talk about macula, in this area.
Macula is the dark
Yeah.
spot right at the center.
Correct.
Uh-huh.
So you can see when it's healthy, that's how it looks like. And
The
bottom,
top two one is healthy.
correct, right eye
Okay.
and left eye.
Okay.
Yeah.
And the bottom two,
You can see there's some difference. So
a lot of difference.
yes. So basically what's happened here is the retina is very thin, and whatever that's behind the retina is starting to show through.
Ah.
So it's a bit like, if the cloth is a bit thin, then you can see whatever
Yeah,
that's
see-through
behind.
kind.
Yes, correct. So whereas the one at the top, the retina is a lot thicker, so you can't see so well what's
Yes.
behind it. Whereas here, we're starting to see behind the retina. So
Yes.
this is someone with high myopia.
This is someone with high myopia. This is
Correct.
not planet. This is not like from some planet. This is actually retina. This is your eyes.
This is a real life,
this
a real
is
life
real
patient
picture.
of
Okay.
some of my patients.
Uh-huh.
So and then these are another few examples.
And
again,
another case, is it?
yeah, different case again, right eye, left eye. You can see in this case, in the left eye, there's starting to be problems here. You can see
Yes.
this.
All these like a
Here.
yellow.
So that's what we call myopic maculopathy. So over there, it's undergone a lot of degenerative change. And so in that eye, the left eye, the central vision is not going to be so good.
Central vision is not clear already. Now,
Yeah,
if
because
we
the
don't
macula-
treat this early, if I have this condition already, will I be prone to blindness if there is no treatment or I do not seek any help? Would you say that it will lead one to blindness?
Fortunately, not complete blindness. So even though the vision is reduced, it won't result in complete blindness.
I see.
It's just the central vision is quite
Blurred.
severely affected.
Okay.
So the peripheral vision should be fine,
Yep.
unless the person has got glaucoma as well, because that's what glaucoma affects.
I see. If you have a glaucoma problem.
Yeah, so if you're a combination of glaucoma plus this, then yes, that is quite challenging, because
Yeah.
your peripheral vision will be affected, plus the central vision will be affected as well.
Right.
So that's going to be quite challenging to manage. And then the bottom here is another case that a patient of mine, and in this case, you can see both the right eye and the left eye has got this myopic maculopathy, and so in this situation, both vision, the central vision, isn't going to be so
Affected
good.
already.
Yeah, be affected, yeah.
Can one just get one eye only?
So, like for example,
Like this.
Yeah, in this case, fortunately, one eye is still okay.
Okay.
But it's it's just a bit of a luck of the draw sometimes. So not everyone gets this, but we don't fully understand why. But of course, the higher your myopia, the more likelihood of running into such problems.
Understand.
Yeah.
Understand. Okay. Great projection. Okay.
So, we've gone through some pictures, some theory of what might be going on.
Yes.
So, as a doctor, as I sit in my clinic, how do patients...
How do patients tell you, doctor, I have blah blah blah?
Yeah, or they may not be aware.
I don't know how to tell you also.
Yeah, they just
I
come,
call
they say,
lah.
yeah, that's right. So they come, they may go, I got a lazy eye, one eye.
Lazy eye.
Correct. So what they mean is that one eye they can't see very well. So it's not unusual for some patients to have very high myopia in just one eye. Again, we don't fully understand why.
Why is it just one eye?
Yeah, the other eye seems to be okay, but one eye with very high myopia. So it's quite common when patients come in, they say, yeah, this one eye I cannot see for very long, maybe since childhood. And then when we check, we find that actually it's because it's very, very short-sighted.
Yes.
But they don't wear
They don't-
glasses because the other
It's
eye
just
is
one eye, but
okay.
the other eye can function.
So they just accept that okay, one eye is called
Lazy eye
yes,
lah. I
correct.
see.
But
Is this a term in clinical?
it is, but the way it's used by the public, of course, is a bit not quite right. But that's how they
Right,
present. They say,
right.
yeah, this is a lazy eye.
Mm.
What it means, they cannot see very well. But when we check, actually sometimes you're quite pleasantly surprised that it's only just because they are very short sight, but they never really tested.
Right.
If they were to wear contact lens or something like that, it
It's
can
okay.
actually help. Improve the vision a lot. So, but that's one way for patients to present. Another way would be they come and say that their power keeps going up.
Right.
So meaning their short sight, like last year was 500, and this year is 600, and then it seems to keep going
Gradually keep going up,
up.
the
It
power.
keeps going up. So and usually it happens when they're around 40s, that kind of thing. So and that usually is a sign that I think your cataract is starting to form again.
I
Back
see.
to the premature cataract, sort of the young age patients. So for such patients, once the cataract starts to form, then they find that their short sight starts to go up.
Quite fast.
Whereas before seems to be quite stable for a lot of years. After childhood, in adulthood, it seems to be quite stable,
Okay.
and then suddenly it seems to start to go up again. So that's when
You should be
that's one of the
careful.
things that we think okay, probably in your situation, cataract is starting to form.
Right. I see.
And then another common way for patients to present would be contact lens related issues, because
Dry
a lot of
eye.
them, they of course wouldn't like to wear super thick glasses. So they wear contact lens, and they wear it from, I don't know, the moment wake up 8 o'clock in the morning till 10 o'clock at night before
Guilty
they
as
go to
charged.
sleep. So
Yes.
so
For long
and
hours.
they have, very long hours. So they come with all sorts of corneal issues, dry eye, corneal infection sometimes, and also ptosis, which is the eyelid starts to droop a little bit.
Eyelids start to droop.
Correct. So this is a recognized thing that happens in patients with contact lens wear.
I
Not
see.
everyone gets it,
Yeah,
but if it droops, then got to see Dr. Siang to lift the eyelid up.
Not plastic surgery to cut your eyelid.
It is a form of plastic surgery, but it is treatable.
It's treatable, right?
So we can do something
Lift
about
up.
it to lift
Great.
up the eyelid
Okay.
if such a thing were to happen.
Okay.
I mentioned floaters already.
Floaters,
Yeah, so
we touched on that.
Yeah, we touched on that. And then of course, they may also come with blurred vision. They may go, my vision is getting more and more blurred. Could be gradual. Gradual tends to be better than, of course, sometimes it's sudden, like one day suddenly
Cannot see.
They can't see. Of course, that's all an indication of maybe something serious
I
has
see.
happened. So,
Suddenly wake up, cannot see.
or
Blur, very
perhaps,
blur.
or half the vision,
Oh,
not
no.
seeing so well. So these are ways that they may present
To the doctor.
to the doctor. And finally, they may also get distortion of vision, which I'll show a case of afterwards why they may get distortion of
Distorted.
vision. Distortion of vision means that things that should be straight start to look a bit crooked. Okay, so
It's very dangerous when driving or like
Wow.
movement, right? You can't even
Yeah.
predict.
yes,
Right,
yeah. So
okay.
or working and everything. So
These are the common lists.
correct. So,
Yes, your patients have told you before.
Yes, that's right. So those who are short-sighted, they are prone to these kind of things when they come to clinic.
Right.
So, so just to provide a few
Case studies.
examples of cases. So, like in this case, patient would notice slowly vision seems to be getting a bit worse.
Yep.
Perhaps over several months, and then
Yes.
suddenly one day it seems to get
Very blur.
very blurred. Okay.
Okay.
So this would be a case whereby the lens had been slowly shifting, so a bit like my glasses, maybe slowly dropping a bit, but can still see.
Automatically.
Yeah, correct. And then suddenly one day it just drops completely, then of course everything becomes blurred.
Yes.
So within the eye as well, the lens could have been slowly shifting, okay?
Right.
Just causing gradual deterioration until one day, like the lens cannot tahan anymore, it just moves completely out of the way.
Oh no.
And so that results in a sudden drop in vision.
Yep.
Fortunately, as I mentioned, things to do with the lens we can normally fix.
Yeah.
So it's not
because
like
it's at the front.
Yeah,
Yes.
right, near the front, so we can fix it. And once we put a new lens in, everything should be fine.
Okay.
Okay, so
Treatable via
yeah.
surgery.
So this is an example of a floater. So this is a vitreous gel where there are a lot of opacities due to age, very short age, and also very short-sighted. So when you combine the two together, then they are more likely to get a lot of these kind of floater things, which just cut out their vision a lot.
Yes.
So they just do
Also
that.
treatable.
Yes.
Oh,
So
okay.
also treatable. We can do an operation to suck out all of the
Now, is this operation long or short, like 10-15 minutes, that what Dr. Xiang has touched about cataract, or longer than that?
A bit longer.
A bit longer.
About half an hour.
About half an hour?
Yeah, about half an hour.
Okay,
So,
not too long also lah.
not too long. So again, if it's really problematic, it is treatable. Not that everyone needs to have their floaters
Fixed,
removed.
like
Only
surgery?
those whereby it's really
Serious.
quite problematic for them. If
Right.
they are quite used to it, it's not really troubling them.
Then it's okay.
Yeah, then just leave it
Okay.
at home. Yeah.
But these are how floaters look like if you have one. Okay?
One of the ways, yeah, correct.
All right.
So back to these color
This
pictures
is
of the
interesting
retinal.
term, the lazy eye one.
Yes, so this is actually a young girl that
Young girl.
in the teens.
Okay, teenager.
Yeah, a teenager that her mother brought to see me because the eye sort of like on one side a bit lazy, cannot see so well. Okay.
Was she wearing spectacles at that time?
Contact lens.
Contact lens, okay.
Yeah, correct. So even though trying contact lens, not seeing so well, especially on the left side,
I
but
see.
on the right side, seeing
It's perfectly fine.
Yeah, much better. And this is actually the color picture of the inside
The
of the
retinal.
eye. Yeah, correct. The retina. And there's this scan that we can also do called an OCT scan, which is like a cross-section scan. So if you look over here,
This is a scan, is it?
Yeah. So if you look at the diagram there, the eyeball is pointed upwards.
Yes.
So the circle there is where the macula
Macula.
is. And so we've got a machine that actually, when it takes a scan, it shows us the cross-section, meaning we are looking like at the eye from the side. As opposed to like the previous images, it's sort of looking
like
for
that.
the front.
Now it's like that.
Yeah, now
Okay.
it's looking on the side. So it's
Side
quite,
view.
So it's quite amazing that we're able to take pictures from the side. And the right eye
Yes.
is on this side, it looks like this, and the left side looks like that. I know it probably is all just black and white, probably it doesn't mean
Yes.
much to you, but just to show you what normal looks like. All right, so when we
This
take
is a normal one.
correct, so normal should look like that. So
Yes.
that's what the retina looks
Like. This is a normal
when
retina,
we-
how it looks like.
correct. How it looks like. So it's nice and compact. It's actually like a kueh lapis, lots of layers.
Yeah, it
like
does
that.
looks like kueh lapis to
Yeah,
me.
correct. Yes. So what you actually see because of a high myopia,
Yes.
the retina is actually stretched.
Yeah, it's very
Yeah, it's
stretched.
sort of like pulled.
Yeah, kind of like pull up the
Yeah,
muscle
correct.
like that.
So it's actually present in both eyes, but we can see it's actually much worse on the left side.
Right.
So it's
Very-
so the retina has been just pulled more and more, and that's why the vision's been dropping in the left eye.
Right.
So we've got a lot of technology that can help us to make the diagnosis.
Very accurate.
Yeah, so it gives us a lot of very good information. And fortunately, in such cases, we can do an operation to release
Oh,
the
really?
pulling. Yeah.
Okay.
And,
Surgery can be helped.
can be done for a case like this.
Okay.
So the diagnosis, the technical term is
Yes.
foveal species, but anyway,
It's
it's
a-
just the pulling of the thing. So we did surgery.
Yes.
And following surgery, you can see the on the left eye before and
Yeah.
after it came down a lot, and the vision actually
Yes.
improved. So So
Tremendous improvement.
yeah. So that's another
After surgery.
happy ending.
Yes.
Yes. So that
Happy
we can-
ending, that's right.
Yes, correct. That we can do something for. Well, of course, the right eye is still like this, but the vision, because it's good, we are not doing anything just yet.
Okay, so the
Unless-
surgery was done on the left eye
Yes, on the
to
left
fix
eye.
this
Yeah,
more
because the
severe,
vision- yeah, because the vision's already
severe
affected.
problem.
Yeah.
Right. Okay, can be treated via surgery.
Yes.
Another one.
So this is another case where we talked about sudden distortion.
Yes.
So things that should look straight suddenly become
The
a bit
vision
crooked.
see like
Yeah, correct. So that is because of a little swelling in this area here, which
Swelling?
again, yes.
Oh.
So again, for whatever reason, because of the back of the eye being very stretched, you get abnormal blood vessels that suddenly pop
Pop
into
up.
the space and then start
kind of like
growing.
inflamed like that.
Yeah, and then just cause all sorts of problems. And the patient suddenly notice that, hey, how come things that should be straight in this eye start to look a bit.
So one eye is perfectly okay, but the other eye she see like
Yeah, that's right.
patient
So
notice.
before it will be straight as well, and then suddenly in one eye it just starts to look a bit
like the
crooked.
TV crooked already.
Yes, correct. So in this case, it's because of this thing.
This,
Okay, technical term for it is myopic CNV.
Myopic
So again, you can see the OCT scan being very useful because it immediately gives us the information that we want.
Yep. OCT via the OCT scan.
Yeah. So that's where the problem is. So
Yep.
these are scans of the same patient, just different cuts.
Yes.
And fortunately, we can treat that.
Okay,
We give
injections. Okay.
into the anti-swelling type of injection. And
To bring down.
correct. So you can see after the swelling
Yep.
that was quite severe becomes a kind of tiny little
Yes.
spot there compared to
Much
before.
more smaller, yeah.
And of course, the distortion improved a lot. And again, yes, another happy ending.
Yes. That's
we
right.
like happy ending.
Yes, we want happy ending.
Correct,
It
yeah.
comes to health.
So yeah, so those are a few examples. And just to come back to how patients can
Yes.
present,
How do they present
how
to
they
you?
present to
Yes.
us, and what sort of problems that I might find. And
So if you are hearing this, if this sounds familiar to you, yeah, this is the
So,
sign. This is the sign that you must go to your eye specialist already. Okay?
Yes, correct. So
Okay.
just
In
to
summary.
summarize, so highly myopic eyes are prone to certain eye complications, as mentioned. Of course, there are other issues as well, psychological and
Yep.
economical. And prevention is always
Definitely.
best.
Better than cure.
Okay, so yeah, so when they're young, before they get high myopia, go for an eye check. Your
Doctors advise go for
ophthalmologist,
eye check.
optometrist, doctors like Dr. Siang,
Yes.
to get the myopia under control. Unfortunately, although we like happy endings,
Yes.
not all complications we can treat. Although with modern technology, more and more things we can.
Yep.
Even if we can't cure, at least we can hope to try to stabilize.
Yes.
Okay, and if anything were to happen, it's always best to detect early
Yeah.
rather than
Definitely.
wait until you cannot see, then
Too
only
late.
go. Yeah, so that's why regular eye checks. That's very important.
Important.
So even though if you feel that everything seems to be fine, once a year check
Yep. It's very crucial.
is important. And of course, if there were any sudden changes, even before the next annual check, suddenly you notice, hey, something is not quite right,
Yep.
then
Seek for medical
seek
attention immediately.
Yes.
Yep. All right. And that's it for your sharing for today. Thank you so much, Dr. Alan Ang, for joining us. Once again, if you have any problems or if you do not know what is happening to your eye, do not know how to express your problem, also feel free to visit Dr. Alan. He is at Isaac Penang at Laru Road. So, ladies and gentlemen, once again, a round of applause for his informative and comprehensive sharing. Thank you so much for joining us.
Thank you.
Thank you.